Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started.
Okay, now we're going to talk about oncology emergencies. What does that mean? That means when there is a particular issue that could require immediate attention, and if not, then it could cause significant harm. So that's what we want to talk about. Why do we want to talk about it? That's because we know when you're going through your cancer treatment, you're going to have a dozen or more side effects happening at the same time, right? And with the treatment, with these side effects, sometimes, despite our best efforts, things can go wrong and something just doesn't feel right. Most people do have 2 to 3 complications while going through their treatment. So we want to be aware of what are the possible things and be able to catch it quickly so that we can catch it when it's just getting started and we can address it so you can have you can get the right help and you can have the best outcomes possible. And of course, we want to try and prevent as many things from occurring, because we want to try and prevent as many issues from occurring by learning and educating ourselves through the different modules and courses that you've been doing with us. So good job there. These are things that still might happen. So we want to know, we want to be aware of them if something like this happens and get the help immediately. All right. So now when we go into oncology emergencies, essentially I'll be covering with you quite a few of the conditions. So I don't want you to get nervous about it. It's not like it happens to everybody. It's not like these are the things that happen all the time. So don't let that deter you. Know that these are once in a while things, and you're educating yourself so that you can be prepared um, for what's coming. It's a broader overall concept. What I would say is that, look, if you are having fever, if you're having infection, you're having fever, or you're having bleeding from any part of the body, or you're not able um, to do the basic physiological things that we do, that's breathing and eating, drinking, any of those regular things, or if you're losing your consciousness, um, or something just feels really off, then it's best to go get it checked out. It's better to err on the side of checking more than checking less when we are going through our cancer treatments. Okay, so with that overview in mind, let me walk you through the different potential emergencies and what you can do about it. How do you can detect it? Oncology emergencies when there is a medical condition that needs immediate attention for our health and well-being. Now, what can you do when there is an oncology emergency? In those cases, before the emergency happens, most of the time you want to have a plan. We work with you to develop your plan, know what are the options, what you can do, have things ready. So you want to do that for yourself, have a plan, know what your center provides in terms of resources or where you can go. Is there a doctor or a clinical team that you can call? So you want to get all that information beforehand. You want to know who is the person who can help you in those scenarios. So now in terms of the different types of emergencies, there are quite a few. I'm going to go through some of the most common ones, and I'll help you to see a pattern in that. All right, so let's get started. So fever. If you're having fever or chills or shaking, then that's something that we want to get checked out. The reason it can happen is because when we are going through a lot of the cancer treatments, our white blood cell count may be low, which puts us at a higher risk of catching infection. The way that's handled is usually by giving antibiotics, whether that's oral or IV, and of course going to be a checkup to see what's going on in terms of what is the infection. Now, the reason it's important to get infection and fever addressed right away is because if there is an infection, we want to prevent it from entering the bloodstream. Because when infection enters the bloodstream, it starts to go and circulate to other parts of the body and affect those parts of the body. So that's called sepsis. So when sepsis happens, it feels much worse form. So there is fever, there is shaking, there's chills, but also it starts to feel, impacting your heartbeat, fast heartbeat, less of the sense of going to the bathroom, and just generally not feeling well, malaise, like feeling nausea and just yucky. So the reason, like I said, is, then the infection has entered the bloodstream. Now, sepsis is treatable. So the way it's treated is when it's identified, we'll do a blood work, check what is the reason for the sepsis, what is the infection. And then once that's determined, then you get antibiotics and fluids, whether that's outpatient or inpatient in the hospital. That's how sepsis can be addressed. And of course, that's why you want to try and do what you can to prevent any risk of infection or sepsis by being careful about hand washing and doing things that can help to prevent infection. We have a full module on that, so you can watch that on how to decrease risk of infection. Now, the next one is let's talk about bleeding. So if you're bleeding from any part of the body, which is not normal, then that's something that we need to look up. So that's called hemorrhage. So whether you're coughing up blood or vomiting blood, or you're having bloody stools or blood in the urine, or profusely bleeding from your skin where it's not stopping, that's hemorrhage. Reasons can be many. It could be because you have low platelet, which is again fast growing cells in your body that could be affected by the cancer treatment, or it could be because of your tumor or medication. So there could be many causes, but the main point to keep in mind is that if you are having bleeding anywhere, then get it checked out, talk to your provider immediately, have them look at it, and then they might decide to give you some kind of fluids or transfusion, or make sure that the bleeding has stopped without impacting your vital organ. Now, what we are doing is going into more depth about different types of hemorrhage, different types of bleeding and other bleeding related issues. So hemorrhagic cystitis is essentially when you're having inflammation and blood in the urine because of the bladder. So if the lining of the bladder is inflamed and it's bleeding, then that's hemorrhagic cystitis. How you will know is you might have blood in the urine, or it appears like reddish pink. It's burning when you're going to the bathroom, or it's difficult to control your urine. It could be hemorrhagic cystitis, or it could be something else. Like it could be UTI, which is urinary tract infection, risk of infection there. Those could be symptoms of that. The reason why this can happen again is, because of our treatments, because of the cancer itself, could be inflaming that part of the body. So the way to prevent this from happening is to ensure that you're hydrating well. So drinking a lot of water, drinking healthy fluids, and eating good, healthy, clean foods. If you're having cystitis, then it's important to go to your provider, and they will do appropriate treatment for you to stop the bleeding and to prevent it from occurring. Now, the next one we're going to talk about is clotting. Usually, when does a clot form? Let's say I cutting vegetables and I got a cut. Now, you might have some blood coming out, but it doesn't keep going. You don't keep bleeding out until every drop of blood from your body is gone, right? Within a few minutes, few seconds, it's starting to clot, and then your blood stops coming out, right? So that's body's natural mechanism to protect itself. Now, what happens if the blood starts to clot while it's in your body, while it's in your blood vessels? then that could be a problem. So that's what DIC is, incorrect clotting of blood. So the way you might notice that is you might see like red spots on your skin, on different parts of the body, like big red spots that are just happening. Or it could be that you're having, bleeding or bruising from different orifices. So, from different holes, as in, from your nose or gums or, vagina, anus. Like if there is any bleeding that's happening, then we want to check if it is from DIC. Again, in that case, we want to give platelets, and there is a very specific procedures for addressing clotting related issues. Very treatable. Again, it's a matter of finding and addressing it. Now, the other type of clotting is DVT, deep vein thrombosis. So DVT is when a blood clot is formed in your vein, so deep in the body where the veins run. There it can, sometimes a clot can be formed. Now, if the clot is formed in one of our core blood vessels that that goes to our vital organs like our lungs or heart, then that could create a lot of problem because it could get stuck in the heart or in the lungs, and it could affect the ability of those vital organs to work. So that's why it's important for us to catch that quickly and address it quickly. Sometimes it's hard to know when DVT or the previous one we talked about, it occurs. But if you are feeling any significant change in your health, you're seeing a lot of blood or clotting or feeling short of breath, whenever there is bleeding that's happening, you're going to be losing blood, which means you might be feeling dizzy, heart rate is fast, you're feeling unconscious. Those could be things that help us to determine and to address it. Those things we need to address very quickly. In the case of DVT, it's much lesser. So if you're seeing any swelling or warmth or pain in any part of the body, again, it's important to get that addressed. There are specific medications for blood thinning that could be used for preventing these kind of clots from occurring in the body incorrectly. Now, another kind of clotting is if the blood flow to superior vena cava, which is another very important blood vessel in our body, when that is blocked, then that could be a problem. So in that case, you might have difficulty breathing, isn't quite significant, headaches, swelling, coughing, just chest pain, all those things. Again, it could happen because of the cancer, it could happen because of clots, tumors. We want to get that looked at, and then the provider, the clinical team will give you treatment for it, generally blood thinners, and then figuring out what is the cause of it and if any procedure is needed. Another one along those lines is called Tumorlysis syndrome. What happens in tumor lysis is that essentially either the cancer cell is breaking down quickly or the cells in your body are breaking down quickly. And when cells get destroyed very quickly, they release different kinds of electrolytes, chemicals, things, right, that were in those cells. So a high concentration of that can be harmful for the body. So that's what is Tumorlysis syndrome. So tumors are breaking down. So the symptoms of those would be, just feeling really sick, honestly. So, a lot of nausea, vomiting, cramping, just feeling very sick. So in that case, again, you want to get checked out, and the way to address it essentially is to give you some medications to get these out of your system, and hydration, so that, again, flushing the body of all these chemicals and electrolytes and things that are being pumped into your body from tumor lysis. Again, prevention, important to drink a lot of water, hydrate yourself well, so that you can be naturally removing as much of this from your body as possible. Now, the other issue that sometimes can happen is something called a fistula. It's not very common, But in certain kinds of cancer, certain kinds of situations where some of the organs are very close to each other, a fistula can form. What is fistula? It's essentially like a door, like an opening between two organs that shouldn't be there, but it is getting formed. So, kind of like a small bridge between two organs. So let's say if there is a bridge that gets formed between your anus and your urinary tract, that's not good because things can move between them. So if such a thing happens, then it can increase the risk of infection, and it could increase other things, can complications can happen. The way you'll know about this is it's not always possible to know, but it'll start to have some certain symptoms and issues. You'll feel pain in that particular area. There is unusual secretions that are coming out of your body. There is foul smell, and generally you don't feel well. Then those are things that could be worth checking out. Like for example, in the case of bladder cancer, or those kind of cancers where we are giving radiation and different treatments in those parts of the body, there can sometimes be fistula formed. So important to get that checked out. Now, moving away from clotting and bleeding, let's go to fainting. Okay, so fainting, never a good sign. Whenever, if you're feeling, if you've had loss of consciousness, as in you fainted, then that's something worth checking out on why it happened. It could be maybe you're just tired, or maybe you're just dehydrated, but it could be something more significant, like we looked earlier, bleeding or something else that is causing this issue. So important to get fainting checked out and get the right guidance and cause of why that's happening. I want to go into different electrolytes and some of the emergencies that can occur from that. So one of that is low blood sugar, hypoglycemia. You might have felt some of these in a normal scenario as well, when you haven't eaten for a long time. If you've gone for days, fasted for a couple of days, you might feel this, right? So that's feeling this irregular heart rate, feeling fatigue, feeling anxious, irritable, confusion, the body and the brain is not getting enough nutrition. So those could be some of the signs of hypoglycemia. When it's more intense, then it could result in the person fainting or seizures or more significant issues. Now, if somebody is diabetic and they're not feeling too good, not feeling like eating, and they haven't eaten for some time, but you've taken your medication, that could also put you in hypoglycemia. So it's important to know if you are taking medications that could be affecting your blood sugar level, whether that's up or down. If you have other comorbidities, like other health conditions like diabetes and other things, again, keep that in mind in terms of how your cancer treatment or the way you're feeling could affect that. Because the way to address it is to replenish the sugar in your body and to know what is causing this issue and address that. Now, the flip side of this is high blood sugar. So again, in the case of high blood sugar, it could happen because, let's say, you're on corticosteroids. So those are medications that increase potentially the risk of glucose in the body. So you want to be careful and know if you are having high blood glucose. The symptoms of those are, increased hunger and thirst, blurred vision, headache, frequent urination, so wanting to go to bathroom again and again, vomiting, dehydration, fatigue, just some of the common symptoms of high blood sugar. If you're feeling any of these and you haven't been diagnosed with diabetes, or don't have a blood glucose monitor at home, then get it checked out, see what your blood glucose levels are. If they're high, then talk to your provider, talk to your clinical team, and they can prescribe a plan of action for you with or without medications that can help to address it. Now, the other one to look at is hypercalcemia. Hypercalcemia is high calcium levels in the body. So that can happen if our bones have calcium. So if our bones are breaking down quickly, then it could release calcium into our bloodstream, and hence we would have hypercalcemia. Or it could be because of several other reasons. The way that might feel is, again, some of the symptoms are quite general, like nausea, vomiting, loss of appetite, headache, fatigue. Now, most of these are symptoms you may be feeling with your regular chemo treatment. So if you're feeling them much more significant and the medications you're taking have a risk of having hypercalcemia, then that's something to keep in mind. The way to address it essentially is to drink a lot of fluids and flush it out of your system, or we give you IV fluids to address it. And there are certain medications that can help with addressing hypercalcemia. Let's go to the heart. So if you're having heartbeat that's like too fast, too slow, just irregular, I mean, what I don't mean here is anxiety. I know like that does sometimes feel like, the heart rate is erratic, the breathing is erratic. This is when it feels more than that, and it's prolonged. It's continuing to happen for a long time. Then you might feel those palpitations or shortness of breath. If you're feeling lightheaded, then those are things that we want to get checked out. And the reason could be like looked at. It could be some of the electrolyte changes, hormone changes in the body. It could be dehydration. We haven't had enough fluids or something else. If the arrhythmia is mild, then the way to address it is to have a lot of fluids and avoid things that like caffeine and alcohol and tobacco that tend to increase the heart rate. So those are ways to avoid it, and limit salt intake. If it is significant, then go see your doctor, and they can check and then provide accordingly a plan of action. Now, one of the emergencies that can happen with the heart is if there is blood or fluid that collects around the heart. So if that happens, you might feel a sense of sharp pain in the chest region, and just have difficulty breathing and palpitation and fainting, as in quite significant. So if you're having any of those symptoms, then it's important to get it checked out. Many reasons why that could happen. Essentially, if there is a bleeding that's happening in and around that region, then that could be the reason for tamponade, or it could be some other reasons as well. So the way it's addressed is essentially we will remove that fluid that is collected around the heart. We'll try to figure out what is the cause and fix that, and hydrate you well so that whatever fluids are lost from your body can be replenished with IV fluids or other things. If you're having difficulty breathing, then we will also give oxygen. Another one is symptoms of inappropriate antidiuretic hormone. It's a hormone that helps the body to remove extra fluids. That's why we go to the bathroom. So if that hormone starts to work incorrectly, then we could have some symptoms like going to the bathroom often, or not going at all, and then just general feeling malaise and not feeling well. It can happen in certain kinds of cancers or certain kinds of treatment that are potentially affecting this hormone or hormones of this kind. In that case, again, we try to identify the root cause, what's happening, why it's happening, address that, and then give you appropriate fluids to replenish, give you medications, give you other treatments as needed. Now, another one is spinal cord compression. So that means the area around the spinal cord, which is the, runs through our whole body. If the area around the spinal cord is getting pushed, why? It could happen if there is like collapse of the vertebra, or because of the cancer treatment or the cancer itself, the tumor is pushing on the spinal cord, or something is causing swelling that is affecting the spinal cord. So then spinal cord compression can happen. The symptoms of that is significant change in the body function. If it's in the lower region, then it affects the nerves around that. So not able to have control over urination or going to the restroom, or difficulty walking, or losing functionality. If you're feeling any of those, then again, important to get it checked out by a provider, see if there is anything going on, get those tests, and then address it appropriately so that the compression can be relieved at the earliest. We covered quite a few of the common oncology emergencies. As you saw, like, these are issues that can escalate quickly, as in they can become acute quickly, and they can have significant impact on our body. At the same time, almost all of them, if handled early and they are contained, can be addressed and managed, so they don't result in loss of life in most cases. So that's why it's important to know and get those addressed. So your next step is to make your emergency plan. So if you're not feeling well, how are you assessing it? Are you taking a check-in with yourself on how you're feeling and how you're going to get those addressed? So if you are unwell, can you go to the provider? Can you go to the hospital? What happens after hours? Is somebody there to take you? So those are things you want to figure out. So if an emergency happens, you're prepared for it, you can address it quickly and get back to our normal course of action.
Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.